Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing health care to the residents of the Washington Township Healthcare District for the past 60 years. Wadhawan.
Good afternoon. My name is Ash, and I'm a physical therapist here at Washington Outpatient Rehab Center in Fremont. Today, we're going to talk about a very important topic, fall risk and how to prevent it. Falls are the leading cause of traumatic brain injury and bone fractures, especially among the elderly. They can cause fractures such as femur, wrist, and hip. These fractures can further lead to more disability and future falls. They are the 6th leading cause of death in the elderly. Let's speak a little bit about the risk factors associated with falls. Number 1, age. The older you are, the more the risk of you suffering a fall. Osteoporosis. Patients having low bone density are more associated with falls. Medications, especially if you're taking multiple meds at a time, they have their own side effects that can interfere with your blood pressure, can trigger confusion, can lead to a fall. Balance or gait abnormalities, if the patient is not using an assistive device when he should be using, or if he's using the incorrect assistive device, that can trigger a fall. History of previous falls can reduce your confidence, can lead to another fall. Ear infections or chronic ear infections or inner ear diseases like Meniere's disease can also be associated with increased risk for a fall. Let's speak a little bit about equilibrium. Equilibrium is a complex function that requires accurate information from several sensory modalities, including your vestibular system, which is your inner ear, your eyes or visual, and somatosensory input. The eyes carry the sensation of vision, sends information to the brain regarding the position of your body. The inner ear tells you on where the body or your head is in space. The somatosensory system, it allows us to interpret sensory messages. They're received from your body or different receptors in your body, in your spinal cord, in your tissues, and in your joints. These 3 systems work well together to provide an accurate information to the brain so it can react to different stimuli, such as walking on an uneven surface, stepping down a curb, or even getting on an escalator. A disequilibrium or falls can be triggered by accidents. You got a loose rug in the house, that can very well lead to a fall. Gait or balance disorders, if you have Parkinson's or stroke, you're more at risk for falls. A drop attack, drop attack is a sudden attack of vertigo in a patient. It can trigger a fall. Postural hypotension, if you're taking multiple medications, if you're taking medications which are not very well controlling your blood pressure, sudden change in motion can trigger a fall in blood pressure and can cause a fall. Visual impairments, if you're not using the right visual aid, if you don't have the right visual aid, or if there's a lack of a visual aid, for example, your glasses are not the right number or it has changed, that can lead to poor vision and can cause a fall. Motion intolerance, skip that one. Motion intolerance. A lot of patients have a hard time sitting in the back seat of a car. They have a hard time stabilizing their vision. That puts them at a higher risk for a fall. Dementia and cognitive disorders like Parkinson's, Alzheimer's, all these patients are more predisposed or more at risk to suffer a fall. It has been shown that the fear of falling among elderly also negatively affects their physical activities. It can cause depression, and it can ultimately lead to fall. Otologic diseases, for example, inner ear diseases, vestibulopathy, Meniere's disease is another example. These vestibulopathy or inner ear dysfunction can affect one side or even both sides. Visual motion sensitivity, as we already talked, for example, being dizzy, or when you watch a movie, or getting car sick, that's very common. And last but not the least, BPPV, or benign paroxysmal positional vertigo. We're going to speak a little bit more about BPPV. BPPV is a common cause of dizziness. It includes transient episodes of vertigo, so they don't last very long. And usually they're caused by dislodged canalets, or these little crystals in your inner ear. When they get dislodged and go to the place where they don't belong, which are your semicircular canals, we're going to speak a little bit more about that later. That's what triggers the vertigo, and that's what's called BPPV. Here's a chart or a picture to show your inner ear anatomy. The utricule and the saccule, these are the main organs in your inner ear which detect linear acceleration. They're sensitive to gravity. This is where the crystals, or the little otoconia, the calcium carbonate crystals, live. And if, let's say, if you move your head in one position, these crystals move in a certain position and send signals to the brain and relay information to where your head is in space at any given time. And these little semicircular canals, there are 3 in each ear, the anterior, lateral, and posterior. And they have little fine hair cells which also send signals to the brain, and they detect angular acceleration. Usually these crystals are located in utricule and saccule, as we speak about, but sometimes a sudden thrust or a sudden blow to the head can dislodge these crystals, and they can travel to your semicircular canals where they don't belong, and that can trigger distorted movements of these fine hair cells which are found in the semicircular canal, and this can trigger benign paroxysmal positional vertigo, or BPPV. BPPV, the common triggers include head motion or a sudden change in body position, such as turning in bed, getting up too quickly. Nystagmus, which is a very involuntary eye movement, is very commonly seen in BPPV. These attacks can last from seconds to hours, and they're very common between the age of 50 to 70 years. And unfortunately, no obvious cause for BPPV has been found. What to do? Well, you reach out to people who know. You reach out to your primary care physician. You reach out to your ENT specialist, neurologist, and of course, physical therapist. We at Washington Outpatient Rehab Center have a vestibular certified rehab therapist who will take care of all your needs for disequilibrium. All of our therapists are very well qualified to take care of your balance needs, fall risks, and even gait training. What can we do for you? We as PTs will perform a full evaluation for your muscular and vestibular system, which will involve taking your medical history, completing a thorough physical examination, which includes your visual, vestibular, and somatosensory systems. And guess what? Treatment begins on day 1. We use these appropriate clinical maneuvers or treatment methods or exercises which will help you reduce your symptoms and make you feel better on day 1. This is an example of what can be done at the clinic. This is how the therapist can assess if your inner ear is working properly or not, or if you suffer from BPPV. Another example of a clinical test is called the modified CT-SIB, or modified clinical test for sensory integration of balance. It's a very quick test, can be very easily done at the clinic. We're going to go through a quick demo of this test. The test is done in 4 steps. Number 1, you start with a firm surface with your eyes open, arms across your chest. Each position of the 4 steps of the test is held for 30 seconds. This is position 1. I am standing on a firm surface, so my somatosensory system is working. It's sending information to the brain. My eyes are open, so my vision is working. And I'm on a stable surface, so my vestibular system is working. So that's position 1, held for 30 seconds. Position 2 is done with your eyes closed. You take the vision out of the way, so now all you're leaning on is your somatosensory system and your vestibular system. So here goes position 2. All right, that's done for 30 seconds. Moving on to the 3rd step. This is where we take the somatosensory system out, or we compromise the somatosensory system. I'm going to stand on a piece of foam that's going to compromise my somatosensory system. This takes care of challenging my somatosensory system. Again, part 3 of the test, standing on a foam pad, standing with their feet together, arms across your chest, eyes open. So right now, I'm leaning on my visual and my vestibular system to maintain my balance, or maintain my position. Step 4, we do all these 3 steps for 30 seconds each. Step 4, we take the eyes away. So now my somatosensory system is compromised. I'm going to take my vision out of the way, and I'm going to solely rely on my vestibular system. And here we go. Hopefully I make it. Okay, 30 seconds. Not all patients can do all 4 steps of the test, but it just gives an idea on what part of the equilibrium is dysfunctioning, on what part they tend to rely on more. Treatments for BPPV. Dix-Hallpike maneuver is used to diagnose BPPV. Well, what we do for treatment depends on what canal is involved. The 3 semicircular canals, the anterior, posterior, lateral, either one or both could be affected, and the therapists at Washington Outpatient Rehab Center would use specific treatment repositioning maneuvers. We call them canal repositioning maneuvers. They can perform them depending on which canal is affected for treatment. Exercises for BPPV or dizziness, they include 3 types: adaptation, habituation, substitution. Adaptation exercises, they are gaze stabilization exercises. They use the plasticity of your central nervous system to diminish or extinguish the symptoms. Going through these 4 slides, the first slide, or part A, patient has 2 targets, and the patient is just turning their head, trying to fixate on those targets. And these targets are fixed. Slide B, or section B of that slide, the target is fixed. The patient is moving their head, trying to fixate their eyes on that target. Slide C, the target moves, and then the patient is trying to move their head along with the target. Slide C, eyes remain fixed, head remains fixed in one position, the target moves front and back. All of these, again, help to challenge your vision, help to use the plasticity of the central nervous system to diminish your symptoms. We're going to go through a little bit of treatment videos to help you get an idea of what fun stuff happens at the clinic. The first one is an example of, or example for gaze stabilization. There we go. So the patient has 2 targets in front of her. She's trying to fix her vision on the target, and then she adds a little head movement along with gaze fixation to stabilize the target. Giving 2 targets in front of the patient, and once she turns her head, gives her something to look at, reduces the symptoms. And let's say if their symptoms, or if the target was not in front of her, that usually triggers dizziness, but since we're giving her something to look at, that tends to eliminate or reduce her dizziness symptoms. All right, the second slide helps us to establish or assess dynamic visual acuity. Sorry, having a little trouble here. There we are. The patient has a little visual acuity chart in front of her. The head is turned at a certain speed. This is for assessment, so the speed is usually kept on a lower pace. The therapist was guiding the patient's head so she can keep up with the pace of the metronome. The next slide is a little bit more advanced, or used as a treatment. We're going to go through the next one right now. Here we are. So as you can see, the therapist is moving the patient's head at a much faster pace while she's trying to read the visual acuity chart. That's used as a treatment video. All right, the next one is a fun one. We use this to treat motion sensitivity training. Got a little cute, cool disco ball in the room. We close the doors, create a little dark space, and here we go. It's a fun one. So the patient is trying to fix their eyes on 2 targets. These are stabilized. She's just moving her head left to right, one target to another. And you can change the direction of the disco ball. You can change the colors to create a little illusion of motion while the patient is trying to fix their gaze on these specific targets. And this could be made more challenging. You can change the speed, you can change the colors, change the direction. A lot of fun stuff. All right, moving on. Exercises to improve balance. We talked a little bit about falls, the risk. We talked a little bit about exercises for dizziness, for BPPV. What about balance? Well, Exercises to improve balance includes lower extremity strengthening exercises, of course balance exercises, and our favorite Tai Chi and yoga. We're going to go through some of the examples for lower extremity strengthening. These are a few examples which you can try and perform at home. Just make sure you're at a safe place, at a safe space, and make sure you have something to have your hands supported, like your kitchen counter, so we're safe. All right, so first one, of course, is a heel raise, toe raise. The second one is a sit to stand. This can be very easily performed with a standard firm chair or your dining table chair. The next one are examples of range of motion exercises for your hip. Again, make sure you're holding on to the kitchen counter, or make sure it's close by, so in case you lose your balance or tend to lose your balance, you're safe. The next one are just some slides for balance exercises. You can do a single leg stand, you can do a single arm stand, single leg stand with an arm raise, you can walk the line. Just a few things to consider. These are just examples. At the clinic, once you come in, our therapist will make sure they do a thorough evaluation. They'll make sure the exercises are tailor-made to your needs. And just remember, not one size fits all. Just because these exercises work for somebody doesn't mean they'll work for all of them. Tai Chi and yoga. Well, research has shown that yoga and Tai Chi is effective in improving postural stability in older adults with a history of falling. They get better posture, there's a reduced risk of falling. So guess what? Get onto that Zoom class with your instructor and get on with the yoga. Just make sure the patient or and the trainer knows about your medical history. All right, preventative strategies. How do we avoid them altogether? Number one, we treat the cause. If the patient's taking too many meds, reach out to the PCP, make sure your medications are consolidated. Use of assistive devices. Patient has a cane, doesn't know how to use it. Patient has a walker. Is that enough for him? So using them and making sure you reach out or talk to your physical therapist here at Washington Outpatient Rehab to learn how to actually use them, to make sure you're using the right device. It has also been shown that targeting exercise program with the underlying pathology or treating the underlying pathology, such as arthritis or muscle weakness, which could contribute to falls. So once you treat the cause, once you treat the muscle weakness, there's a reduced risk for a patient to suffer fall. Higher levels of activity or physical activities have also been shown to reduce the risk of falling and morbidity and mortality between 30 to 50%. So make sure you're physically active. Get onto that daily walk, and that should definitely help with reducing the risk of fall. It's also been shown that not just aerobic and anaerobic, but resistance exercise has also been helpful in reducing risk for a fall. And better yet, we're here. Reach us out at Washington Outpatient Rehab Center. We have a therapist who specializes in vestibular rehab, and all of our therapists are very well qualified to treat all your balance and preventative strategies needs. Thank you. We're ready for questions?
We do. We have some questions. First question is, can BPPV be prevented?
Unfortunately, because there's no underlying cause for BPPV, it can be prevented, but it can very well be treated. It can be treated by the repositioning maneuvers we spoke about, and like I mentioned, we have a therapist who's certified in vestibular rehab who is very well equipped to treat BPPV effectively.
Okay. Next question. I tend to get dizzy on a windy road. It gets worse when I'm a passenger. Can this be treated?
It depends. Motion sensitivity, sometimes if you've had this all your life, if you've had this for as long as you can remember, you can't really treat that. But if it was triggered after an ear infection or something like that, then yes, it could be treated by one of the videos we saw. That was the fun one. But yeah, if you're born with it, or if that's something you've had all your life, then that's no, we cannot. Unfortunately, can't be treated.
Okay. How do I know if I'm using the correct walker or cane?
Well, that's a very good question. You know, we see this, our parents or elderly, they're not walking very well, they're holding on to things, and we tell them, oh, you know what, let me get you a cane. Well, sure, on our side, we're doing the right thing, but is that the right device for the patient? So, of course, the answer is reach out to your physical therapist, reach out to us, make an appointment, so the therapist can assess the gait of the patient. The therapist can assess their balance, and then recommend the right cane. Teach them how to use it, if cane or walker or one of the devices. So that way they feel comfortable and confident to use it at home, and you know, it kind of matches their needs depending on how physically active they are.
Okay, my mom is older and lives alone, and because of the pandemic, she is by herself a lot. What can I do to make sure she is safe from falling, especially at night?
That's a very good question as well. Sure, our patient uses a cane at daytime. Well, guess where it is at nighttime? Stays in the kitchen. So at nighttime, it's very, very common when elderlies, they wake up in the middle of the night, don't have their cane, the light's off. It's a recipe for disaster. So certain things you can do is if they use a cane or a walker, make sure you leave it with them next to their bedside so they can easily reach for them. Make sure there's a night light so their eyes can adjust to the vision, and so they know which way the bathroom is. And just make sure there's no loose drugs in the area, because that could very easily cause a fall.
Okay. The last question, do I need a referral to visit the Washington Outpatient Rehab Center?
It depends. It's insurance-based. Most insurances do not need a referral, but I think the best answer would be to call the front desk, and they should be more than willing to help you make an appointment in case the referral is needed or not.
Address again, can you bring up the last
The address
slide?
to Washington Rehab Center is 39141 Civic Center Drive, Suite 120, Fremont, and it's on your slide as well.
Great, thank you. Well, this concludes our program for this afternoon. Thank you, Ash, for your expertise, and thank you to our viewers for tuning in. The entire broadcast of today's event will be available on our Facebook page. We look forward to hosting more Facebook events in the future. Thank you.
Thank you.